Are you worried that you may have scoliosis? Scoliosis can be characterized by the side-to-side curve it causes in the appearance of a person's spine. Scoliosis is a complex deformity that often looks like the shape of a C or S. There are three common categories that this condition is often classified, and they are as follows. Neuromuscular. This describes the category of scoliosis that develops as a secondary symptom and is due to having some other type of health condition. Some of the most common include spinal muscular atrophy, spina bifida, polio, cerebral palsy, and physical trauma. This is simply because diseases like this can cause a person to suffer weakness of various muscles, paralysis, and muscle control that is poor. Idiopathic. The specific cause of this type of scoliosis is not known. Depending on when the onset of the condition occurred, they are subclassified as having one of the following: infantile scoliosis, juvenile scoliosis, adolescent scoliosis, adult scoliosis. Congenital. This particular category of scoliosis is due to vertebral anomalies that can be seen at birth. Ribs that are fused and abnormalities in the way the spine is formed can occur in the early stage of life and while a fetus is still developing within the mother's womb. Common symptoms that are associated with scoliosis. A majority of children that have scoliosis do not experience any type of symptoms. However, symptoms that some people do experience include those listed here. Abnormal curvatures of the spine that occur laterally. Backache or pain in the lower back. The hips or the shoulders will appear to be uneven. Fatigue. When a person experiences fatigue, it is usually because they have been standing or sitting for an excessive amount of time. When the soft tissue of the back area becomes irritated, it can cause persistent pain. Tests that are commonly performed to check for scoliosis. As soon as scoliosis is suspected, it is important to make an appointment with a family care physician. They have the skill and knowledge that is necessary to give a proper diagnosis. One of the first tests that they will commonly perform when the patient is believed to have scoliosis is a physical examination. During this exam, the patient is usually asked to bend at the waist so they can look closely at the spine. If a person's pelvis seems to be tilted or one of their shoulders looks to be higher than the other, there are other tests they may want to perform as well. A scoliometer is often used, which is a medical tool that is used to measure the spine curvature. X-rays of the spine and an MRI may also be suggested. The main reason that X-rays are so important is that they are much more accurate for showing the actual curve of the spine. An MRI can be helpful because this test can show changes in the nerves and problems that appear to be unusual. While there is no treatment that is needed for a large number of cases, patients need to be seen on a regular basis by their family physician. Thank you for watching another Unstoppable Intellect video. Don't forget to like and subscribe to help keep the channel growing. Knowledge is power. Together, we'll make you truly unstoppable.